Hello, and how are you? Yes, this is Ask the Doctors, and my name is Dr. Frederick Unuigbokhai. Some people call me Dr. Fredo Star. And like I always say, good life, not sense. I'm live currently on TikTok and I'm live on Facebook. Now, if you're just coming, you're welcome. For those that are watching this video after we have ended, sorry, I might not be able to respond to you. So this is Ask the Doctors every Sunday by 8 p.m. West African time. I have some people currently joining me on TikTok. I have about 14 people online on TikTok. And how are you? Now, today's topic is very, very interesting. If you are just coming, say hello. Let me give you a shout out. If you are just coming, say hello. For those that want to join us on Facebook, you can move over to my Facebook page and we will take your comments and your questions on Facebook. Yes, I'm live on Facebook and I'm currently live on TikTok. Um, so, welcome. Where are you joining me from? Drop in the comment section. Tell me, where are you joining me from? Let's go. For those on Facebook, where are you joining me from? Talk to me. Oh, yeah, let's go. Today's topic is a very interesting one. Most ladies have been asking, Doctor, I see my period 2 times in a month. Okay, Vigas from Italy. Oge from Abuja. I see you. Blessing. Good evening, Blessing. Evie. Evie, hi. Florence. Hi. Ude Ada. Hi. Florence, hello. I see you all on Facebook. Jacob Momo, hello. Olainton. Anna, hi. Olainton, how are you? Good evening. Welcome on Facebook. So we are currently live on Facebook. Please share this video. Share this video. Tag your friends. Tell them to come join us. Okoji Antonia is joining us from Lagos. Okay, I see you all. Welcome. Now, most ladies have been asking these questions that, Doctor, I see my period 2 times in a month. What is the problem? So I decided, let's talk about it today. Abdul Dokas from Lokoja, Kogi State. Hi, how are you? Just Bright, how you day? Evie, Evie from France. Tonight's topic, please look at tonight's topic. We are not taking any other topic until we are done with this topic, and then we can try to take some other comments. Do you understand? And don't forget, you can also send stars. You can send stars to support. So please remember, you can send stars. Not that until we now become celebrity, that's encourage this ministry from here. Good. So this is the topic tonight. Menstrual period 2 times in a month. Why? Why should a woman see her period 2 times in a month? Is it normal or abnormal? So let's start like this. First of all, it's important that look at the topic. Look at this topic. This is the topic tonight, please. This is the topic. I have my colleagues and my co-host. I'm expecting them to join us tonight. When they come, I'll also bring them online. We're talking about this topic. When we are done with this topic, we can now take some other comments from you, some other questions from you. Do you understand? uh I have Dr. Israel in the house. Dr. Israel is here. Dr. Israel, how far?
I'm fine. Oh, good evening.
Yeah, so let me open this so that how you did? How far you dey hear me?
Yeah, you said what?
Okay, you dey hear me now, Abi? You dey hear me, right?
Yes, I dey hear you.
Hello. Okay, very good, very good. So we are live on Facebook. We have 32 people online. We are currently live on TikTok. Just let's carry those on TikTok along with us. For those that want to send us stars, please, you can send stars on this live and support. Good. So let's talk about the topic
Yeah,
today.
very
Menstrual.
important.
Yes, yes. Menstrual period twice in a month. Is it normal? Is it abnormal? Why should the lady be bothered? Let me hand over the floor to my co-host, Dr. Israel. Please go ahead. Yeah, Dr. Israel. You dey hear me so? You dey hear me? I mean, you dey hear me?
Okay.
Wetin dey happen?
I want to say something before we talk about the um if it's normal or abnormal. Um, are you hearing me?
Yeah, I can hear you. I can hear you.
Hello, can you hear me?
Yes, I can hear you. Oh God. Oh God. Oh God.
Okay, as I was saying, I want to first of all say what I want to say about the menstrual period. I want us to first of all define one term called cycle. You know, the cycle is from one menstruation to another menstruation, give you a cycle. So when I
Dr. Israel, your network is not stable. Oh, your network is not stable. I don't know why. I don't know why your network is not stable. It's fluctuating. Good evening, everybody. Welcome. So let me continue from where Dr. Israel stopped. I hope he'll be able to fix his network and come back. So the menstrual cycle. Every woman should know her menstrual cycle. Very important. Every woman is expected to know her menstrual cycle. If you know the length of your menstrual cycle, tell us. Now, your menstrual cycle is the number of days from one period to another. Some women have their menstrual cycle 28 days, average 28. Some women have 25. Some have 24. Some have 30. Some can even have 35. Now, if you don't know the length of your menstrual cycle, then you would be bothered. You go dey cry. Wetin dey happen to me? Why is my period coming once in 2 months? Why is my period coming out twice in a month? So it's important you know the length of your menstrual cycle. And the length of your menstrual cycle, you calculate from the first day you see period to the next day you see period. If you want to get the average, you do that for like 3 months. Okay, Yinku's mama on TikTok, Yinku's mama 505 says, mine is 24. Very good. I'm happy you know you. Damsel on TikTok says, mine is 30. Those on Facebook, ladies on Facebook, what is the length of your menstrual cycle? Damsel says hers is 30. Yinku's mama says hers is 24. Yes. Dr. Israel, are you here now? Okay. Can you hear me, Dr. Israel? Can you hear me? Okay, let's bring him back up. Yeah. Okay, good.
Yeah, I can hear you.
So go ahead, go ahead. Mine is 28.
Yeah,
Yes,
I
go
was
ahead.
saying I was saying that we need to first of all define cycle before we can actually say if menstruation seen within twice in a month if it's good or bad. So cycle is the beginning of one menstruation to the return of another menstruation. That is when you start your first menses, after that menstruation has ended, when you will see it again, makes it a cycle. So we about we're giving a range when you can say this is the normal cycle. So we have a short cycle, we have normal cycle. Are you there?
Your network is breaking, but you are back. Your network is breaking up.
Dr. Fred.
I'm here. I have always been here. You are the one leaving me and coming
Dr.
back.
Fred.
Okay. His network again. Oh my God. Dr. Israel, which network are you using? So if I understood where my co-host was driving at, so what he's saying is that we have short cycle and we have long cycle. Now, this is the topic. Please look at the topic, menstrual period, twice in a month. Why? And Dr. Israel says it's important you know what is menstrual cycle from the beginning of one period to the beginning of another. and it has an average of 28 days. EC Osegale on Facebook says hers is 28. Princess Uwa says hers is 28. Um, uh, Chums D on TikTok says hers is 28. JJ says hers is 28. Damsel says hers is 30. It's important. Now, if you don't know the length of your menstrual cycle, then there'll be a problem. We have what we call short menstrual cycle, like 21 days. Some women have their menstrual cycle of 21 days, and it's still okay, but it's a short cycle. Some women have long menstrual cycle, the longest, which is normal, and that is 35 days. So what this simply means is that within the range of 21 to 35 days. So if your menstrual cycle is 21 days, 22, 23, 24, 25, 29, 30, 31, 32, 33, 34, even 35, it is still normal. Are we together? Florence says hers is 28. Very, very important. Everybody, please listen carefully. I hope Dr. Israel can come back and join us. Not everybody will have 28-day cycle. As we can see on this live stream here, we can see that some people have told us, and they have told us theirs. Example, Just Bright says hers is 35. Macaulay Angela says hers is 30. Evie he says hers is 25. What this tells you is that not everybody would have a 28-day menstrual cycle. Now, if you have a 21-day menstrual cycle, it means that if you start to see your period, let's say on the first day, this is November, Abi? Good. Let's say you start seeing your period on the 1st of November, on the 1st of November, on the 1st of November, and the length of your menstrual cycle is 21 days. It means that if you count from that first, you count 21 days. It means on the 22nd of November, the same November, you should be seeing another period. Does that make sense? It changes, correct. Shakirat, I see you. If you have a 21-day menstrual cycle or 22 or 23 days menstrual cycle, and you start to see your period on the 2nd of November, 2022, and your period is 23 days. So it means that from that 2nd of November, if you count 23 days after 2nd, it will fall on the 25th. It will fall on the 25th of November. So this lady with a 23-day cycle, or 22, or 21, or 24, will see her cycle, her period, in that same November. Yeah, Baba, well done. Are we together? Yeah, okay, Dr. Israel is back. Okay, Dr. Israel is back. Okay. Dr. Israel, can you hear me now? Hello.
Yes, I can hear you.
Yes. Welcome. Can you hear me? Can you hear me?
Yes, I can hear you. I can hear you clearly.
Okay, so let me hand over to you and let me just say what I said before so that you can continue. So I mentioned that we have, hello PJ, it's been a while. We have 21 days, 22 days, 23 days, which is short, still normal. We have 30, 32, 33, 34, 35, which is normal and long cycle. So it's a range, and we have an average of 28 days menstrual cycle. And also I said that some women with 21-day menstrual cycle, if she starts to see her period on the 1st of November, it means that by the 22nd or 23rd of November, she should be seeing her period again. So please go ahead, sir.
Okay. Yes, I think you've actually said it all. Remember, where I stopped was that there are different type. We have a short cycle, we have a normal cycle, and we have a long cycle. So I think he has already given us the range for the normal cycle, which is from 21 to 35 days. Yeah. Is it 21? Yeah.
Yes.
Okay. Yes.
Plus or minus 7.
21 to 35 days is a normal cycle. So anything shorter than 21 days is a short cycle, and anything longer than 35 days we regard it as a long cycle. So for any individual that their cycle is within 21 days, they are likely going to see their menses twice in a month on few occasions. On few occasions, they are likely going to see their menses twice in a month. Why those? Yes, that's why it's not like it is very bad to actually see your menses twice in a month. It's only when you have counted, you count your cycle and you notice that it is shorter than 21 days, and that is why we can be saying that there's one problem or the other. And as at that time, we will not be telling you, yes, you have to do this or do that. You need to visit a gynecologist to know why you're having a short cycle and what can be done to make sure that it does not occur like that. Yes, I know that there are some persons that will say, I see my menses today. After 2 weeks, I am seeing my menses again. The next question we normally ask sometimes is the menses you are seeing again after 2 weeks, is it coming out like what you saw before? So some persons it doesn't actually come out like what they saw before. Sometimes they may just see it like a little blood stain, a little blood stain. So when you see something like that, a little blood stain, most of the time there's something that is called ovulation blood spotting. Ovulation blood spotting. It means that the person is within the ovulation and you can just see a little blood spot at that point. So it can happen for 2 days. It can happen for 2 days. So some persons may mistake it for their menses again, which is actually not their menses. And one thing you should know that it doesn't come out like your menses. It doesn't come out like your menses. That's one thing that most persons can make mistake. Another thing is that there's another thing we call implantation bleeding. Maybe this person is already pregnant and hello, are you with me?
Okay, you are back. Go ahead.
Can you hear me?
I can hear you, but your video is delayed. Or yeah.
I'm back.
Are you back? No, you're not. No, you're not. No, you're not. Okay, let's see. I think you are back. Let's see. Okay. Okay. Can you hear me now? For those that are just coming, you are welcome. We have Dr. Israel tonight with us, and we are talking about menses. Why should a woman be seeing her menses twice in a month? And then we're talking to people. This is the topic. We are not answering any question yet. We are talking about something. So please, guys, we are not answering any
Okay.
question. I
Can you
beg
hear
you.
me?
I can hear you. Can you hear me? Okay, I can hear you, Dr. Israel. What is happening? What is happening? Okay, you have to go out and come back in. Good evening, everybody. I guess your network, I don't know what's happening to your network. Dr. Israel, please exit and join again. I don't know what is happening. Yes. We are not answering questions yet. I beg you. Please. People say answer me now, answer me now, answer me now. One is answer me now. We are explaining something for people, and people just want to start asking. Relax, let's say something first. People are just joining us along the way. So you don't understand where we are coming from. We said that if you have a short cycle, like 21 days, 22 days, it's normal to see your period twice in a month, most especially if you know the length of your menstrual cycle. Now, if your cycle is not 21, is not 22, is not 23, let's say that your cycle is like 30 days, and then you saw your period this month, and then you are seeing your period again this same month, then we have to find out what is going on. Is it that there is a change in your body? Sometimes it might be ovulation bleeding. Some women don't even know the difference between ovulation bleeding and their period because the woman is just seeing blood. The lady is just seeing blood. she thinks that it is period. No. Is that okay? Dr. Israel, are you here? Okay, he's here. Oh. Dr. Israel is here. Okay, Alpha, can you hear me now? You are on mute. I'm unmuting you. Okay, Dr. Israel, oh yeah, unmute yourself now. Unmute yourself, please. And go ahead, please. Oh God, what's up? Should I go? There's a problem. Oh. Okay, those on TikTok, somebody is commenting on TikTok and says, but mine is 32, sometimes it's 35, but now I have not seen it this month. And you relax now. Dr. Israel, can you hear me now?
Yes, I can hear you.
Go ahead so that let's start taking questions. We have so many questions pouring in already.
Okay. Okay. As I was saying, I've already talked about ovulation blood spotting, which can actually occur. That can occur at least for 2 days. For some persons, it can occur for 2 days. And some persons will actually think that is menstruation again. Actually, it may not just be your menstruation. So one of the questions we want to find out is to know, how is the bleeding? Is it like what's your normal menstruation? For some persons, they will say no, that they just saw it small, it just come out small. So for some people, we don't want you to be scared. We just say, okay, don't worry. Let's see how your next message will be, because we actually know that yes, for some of you, it's actually not your message. So I've told you that yes, seeing menstruation twice in a month is possible for most persons, even with normal cycle. Their normal cycle, even when it is 28 days. So it now depends on the date that you saw the cycle, your first menses. If you see your first menses on the 2nd and you are 25 days, your cycle is 25 days, you are likely going to see it again that same month. You are likely going to see it again that same month. If your cycle is even 26 days and your first menses was seen on the 5th, you may likely see it, is it 5th now, or on the 4th or 2nd, 4th or 3rd or 4th, you're likely going to still see it the same month. That's why I said for some persons that have normal cycle, they have normal cycle. You remember what we said normal cycle is from 21 to 35 days is a normal cycle. It's not a short cycle and it's not a long cycle. That's a normal cycle with the average of 28 days. The average of 28 days. So for you that have 28 day, 21 within 21 to 28 days, most times you may likely going to see your menses twice in a month. It's normal. It's normal for those persons. Why for those that have short cycle? Yes, some persons normally their cycle is short. Their menses is short, like 20 days. But those kind of persons, even the 21 days, which is we know is within the normal cycle, but it's also short. For such persons, they will always see their menses twice in a month. In most cases, they will likely see their menses twice in a month. However, if you are the kind of person that have been seeing your cycle has always been 28, 29, 30, suddenly overnight you just notice that your menses became very short, very short. Okay, that's why what can you can it can cause for it can cause for an alarm. That's when you can actually want to see a gynecologist. Well, sometimes if it happens just once, you may not need to worry yourself. So sometimes we want to see that it happens at least twice before you start crying, because sometimes there are some things that can lead to hormonal changes. Stress is one of it. Stress is one of it. Change of environment can also cause hormonal changes, and that can actually alter your menstrual flow. Now, for most persons that may have long cycle, for premenopausal women, yes, their cycle may become a bit longer than normal. Can become a little bit longer than normal. So if also you've taken some medications, you're taking some medications for those that want to, now, or those that take after how would I call it? After peace now, that's supposed to know. For those that take those kind of pills, you're likely going to see your for the first period, you may likely see your period twice in that month until your hormonal system become balanced, and then you start seeing it as you normally see it. So I want to let you guys know that seeing your menses is not like a monthly thing. I know it almost follows that rule, but actually it's not really a monthly thing. It's not really a monthly thing. So some persons that their menses is as long as 35 days, they may even see it once in almost 2 months. For some persons, not everybody. So if you calculate, there's a way to get the calculation. You notice that you may see it in 1 month. The next month you may not see it until you get to another month again. Maybe the earliest part of the next month. It can just happen at that. So that's to let you know that normally menstruation is not actually a monthly thing. We normally calculate it using the cycle. That's why I first of all make you to know that cycle is the beginning of one menses to the return of another menses. Yeah. So with that, you know that yes, some persons can actually see their menses twice in a month.
Thank you, Dr. Israel. Now, with what you have said, I believe we now understand that seeing your period twice in a month for those with 21, 22, 23 day, 24-day cycle is normal. So that you don't, because ladies believe that when they see their period twice in a month, there's a problem. They have this mindset that period must be once in a month. For those with short cycle, you can see your period twice in a month and you are still what? You are still fine, as Dr. Israel has explained. Now, another thing that I keep seeing on this page is that somebody has been asking us, and this last month, my cycle was 28. This month, my cycle was 30. 2 months ago, my cycle was 26 and 26 days. I think it's 29. It's not stable. Now, let me say something about this. Then Dr. Israel is going to act also on that. Now, remember that your body is not a machine. Your body can change. These hormones can fluctuate, can change. And like he has mentioned before, there are few things that can change these hormones, even stress. So let's say last month you went through heavy forms of stress. That stress can alter your hormones. Or let's say this month you didn't sleep well. You couldn't sleep for whatever reason. Maybe you were working overnight, you were preparing for an exam, you were traveling for business. All these things can alter your cycle. So last month might be 28, this month might be 29 or 30. It must not always be that same number. But with an idea, you now know that my cycle revolves around 28 and 30 days. Dr. Israel, do you have anything to add to that?
Yeah. You remember we've already told you what is the normal cycle from when to when. So if your cycle is falling within that period, you are still normal, as Dr. Fred has said, and so many factors can actually change it. The body can just play a fast one on you. And in fact, you should know that it is very rare for a particular lady, one particular lady, to always have this menses every 28 days. There will always be a change in this world. Okay, let's use this country, in this Nigeria that we are. There will always be a change, because of so many things. So yes, it's not a bad thing for you to see your menses this period 26th day, the next time 30 days. It's not about it's not wrong. It's still normal. You just know that it's the circumstances that surround your hormone that actually has caused that. So it's normal. As far as still within normal range for normal cycle, so it is normal. You are mute. You are mute. You are mute. You are mute.
Yeah. Thank you
Okay.
very much. It's normal. We have said it is normal. For those that are just coming on TikTok, we are talking about why should a woman see her menses twice in a month? For those on Facebook, why should a woman see her menses twice in a month? And we have broken it down for you. That is what we are saying, Abi. Good. We're going to go further. We also spoke about the things that can change the length of your menstrual cycle. Please, oh, you can support this live stream by sending stars. Eh? No be only that the phrase una go dey send stars. Send us stars too. Send us stars. Support us. Now, Dr. Israel, there are few things that can make a woman have issues with her menses twice in a month. You listed some of them. One can be hormonal imbalance. One can be perimenopausal. The woman is getting close to menopause. These are things that can fluctuate our hormones. And we have said it here that because you saw your period twice in a month for the first time is not enough for you to start panicking. Do you understand? For the first time, your body might just change and it might regulate itself back to normal. But if you know that your period, your cycle is 30 days, and you saw your period twice last month, this month again, you are seeing it twice again, then you are a candidate to see a gynecologist. Is that okay? Now, if you have questions
Yes.
on this topic, please drop them in the comment section for those on Facebook so that we can pin your comments on the screen and then everybody can see. While for those on TikTok, I might just be the only one seeing your comments, and then we'll take it. So, Dr. Israel, do you have anything to add again?
Yeah, I think I added drugs. Drugs can still make some persons see their menses twice. And also, I want to say infection can also do the same for those that have infection. So the infection, the other bleeding you see may not even be your menses. It might just be due to inflammation of some part of the cervix that actually leads to that bleeding. Because sometimes when the even when the okay, we also have what we call abnormal bleeding. Yes, abnormal bleeding. When there is a cancerous cells within the cervix, and when there's a little break to a little breach in that region, it can lead to bleeding. So some persons will see that blood flow and think it's measles. Actually not. It's actually not measles. It can just be an infective period process that is
Okay.
actually going on. So these are some few things that will make you see, that will make you at least more than once in a month. Yeah.
Okay. We have few questions. Please start dropping your questions. Don't forget, share this live stream. I beg you, share the video, share this live so that more people can join us. We have few comments on TikTok. So Stephanie is asking, I have been menstruating for 6 days now. What could be the cause, please?
Hello, Dr. Fred.
Yes. Can you hear me now?
You are breaking.
Okay. Okay, so I'm back now. I believe you can hear me. So I want you to please respond. Stephanie is
Yes.
asking us a question. She says that she has been menstruating for 6 days now, and she's bothered. What could be the cause?
Okay. One thing I want to say is your menstrual flow is from 2 to 7 days. 2 to 7 days. So when you see your menses within this period, it's normal. However, if you are the kind of person that have been seeing your menses 3 days, often, always, and overnight.
What happened to Dr. Israel? And overnight, you notice that your period is now 5 days, 6 days, or 7 days. Then there's a problem. Then there is something that needs to be done about it. And that is what Dr. Israel was trying to say. If you haven't seen your period every 3 days, your period for 3 days, 3 days, 3 days, 4 days, 3 days, 4 days, and then now you notice that your period is now 6 days, 7 days, it has changed, then you need to find out what is going on. But if your period has been 3 days and just this month you notice that your period is now 6 days, calm down. Don't be so much in a hurry. Do you understand? Don't be so much in a hurry and give yourself time and find out if it will regulate again. But what we have noticed and what I have noticed is that The moment a woman's body changes for just this month, she's panicking. Doctor, my period was 3 days, 3 days. This month is now 5 days. Hey, what's the problem? Madam, relax, relax. We are eager for medications. We are eager to look for problems. Your body, remember, your body can change. Yes, Madam Amaka, good evening. I see you. How are you on TikTok? Hello, guys on TikTok. I've been away from TikTok for a while, but I decided that let's have this live stream on Facebook and on TikTok. Now, the reason I am not on TikTok actively again is one, the app is messing up. Number two, the device I use for my TikTok, the phone, get as it be, they do well. Now I know they come online. So make an no vex here. Very good. But I'm very active on Facebook. I'm very, very active on Facebook. So you can follow me on Facebook, Dr. Fredo Star 1 or Dr. Fredo Star Official. Good. We have a question from Rebecca. No. We have a question from Shakirat Obayomi. What's the normal age for a woman's menstruation to stop, please? The normal age. It's not like there's a normal age. It is a range. Do you understand? Because let me say this. A woman might get to this age. If you ask me for one age now, she might get to that age and she's still in a period. So it's a range. But from about 52 years, the average age for a woman's menses to stop, 52, menopause, 52. For some women, it could be earlier than that. It could be 45, could be 50, could be 55. So a woman might get to 50, 52, 53, she's still seeing her menses. For another woman, she might get to 48 and her menses has stopped. Shakirat, do you understand? Is Dr. Isra here? Okay, he's not here, his network. Shakirat, please, don't forget to send me stars. Send me stars. Not this one you are sending on the screen. Digital gift, the stars they buy to encourage us on this app. Send us stars. Not just be looking at us like this. Abba, you don't want to encourage my ministry. Encourage me now. Is it until I do, you are blessed, you are hid? No. This one too is ministry. So Shakirat Obayomi, I've given you the answer and I hope you understood, right? Very good. Yes, very good. Now, Rebecca is asking us a question. I'm coming to TikTok. Thank you, Mommy R, for the gift. Rebecca is asking us a question on Facebook. At times, if a person blood tonic, menstruation will flow more than 5 days. I don't understand, Rebecca. I don't understand your question. Please ask your question again. Rephrase it. Just Bright, please, what can cause sudden, heavy, and continuous bleeding with loss of pain? Okay, a woman should not be having sudden, heavy bleeding. But maybe hormone, maybe something happened to her the previous month, maybe stress, hormone change. But if a woman is having continuous, 3 months ago, 4 months ago, she has been having heavy bleeding, continuous heavy bleeding with abdominal pain. The bleeding is heavy, more than normal for the past few months, continues like that. That woman is a candidate to see a gynecologist because there are many things that can make a woman have heavy bleeding. Yeah, bro. Okay. Snow Wizzy, thank you. You get why? I rephrase them. But Snow Wizzy is a medical doctor on TikTok right now. He's currently live on TikTok with me. Snow Wizzy, how far I don't say. So if a person is on blood tonic and she notices that her menses will flow more, is that what you're trying to say? So, I don't think so. Blood tonic should not make your menses flow heavily. It means that there is something else. See, there is something else that is changing your period. You understand? Yes. So if your menses is heavy and continuous, there are many things, many things like I don't want to mention so that I don't make you start getting scared. But trust me, it is not normal. So if your period is heavy, more than normal, you used 4 pad before, Now you are using 7, 8 pads. Your pad is becoming very soaked. Sometimes the blood spills and stains you. You are having severe abdominal pain, which was not there before. You should be seeing a gynecologist. Okay. See questions. Oh. Doctor, I don't join you here. Oh, Amaka from TikTok. Amaka don't come Facebook. Amaka, let me pin your comment. Doki, I don't join here oh, from TikTok. Yes, yes, Amaka, I see you. I see you. I see you. Welcome. How are you? How is Ireland? Welcome. My TikTok people, you can come over to Facebook. Yes, thanks for your time. Let's see. Esther. Okay. Yes. Okay. So wait, let's attend to one comment on TikTok. I am pregnant. Thank you, doctor. Oh, Jesus, you're pregnant. Favor. Congratulations, madam. Congrats. I don't know why you are thanking me. I swear to God Almighty. I really don't know why you are thanking me because you know, saying our advice with the give people online, Abby. And maybe the advice work for you. So congratulations. God bless you. And we are happy that you are pregnant. And your pregnancy would be stress-free. You will born your pikin, eh? So congrats once again. And I'm very, very happy for you. Somebody is saying, please, having serious cramps during pregnancy in the first trimester, is it normal or will it stop? So Snoweezy has responded to you. Snoweezy, edit your username now, please, so that they will know you're a doctor. If the cramps are serious, you need to get it checked out. So when a woman is pregnant and she's having severe menstrual pain, cramp, you see, it's not even menstrual, cramp, contractions, please get it checked. See your doctor. Glory, how are you? Yes, yes. Now you give them it's no easy. From here, from TikTok to here. Okay, I see you. Yes, Amaka, I see you. You're back on TikTok. Okay, very good. Okay, so sorry guys. Sorry. We are responding to somebody on TikTok. You see that we are on many app now. So she said she has gone to the hospital for checkup and they gave her only paracetamol. Okay. If you went to the hospital for checkup and they give you paracetamol and the cramp is still there, listen, and the cramp is still there, my advice would be that you should go back. Please go back. Tell them that the cramp is still there and the PCM is not working. I don't know if Norwegian has a contrary opinion. So, Esther, my menses is very thick and sticky. Is it normal? My ovulation also is sticky. Ovulation is different. Go and watch my video on ovulation, Esther. But menses thick. What do you mean by the word thick? As long as it's coming out regularly, it is flowing regularly. There is no unnecessary smell. There is no severe blood clots. I think you should be fine. Dr. Israel is back. Doctor, how are you, sir? Rita. Okay, I'm scrolling up. Rita, I'm scrolling up. Dr. Israel, can you hear me? Dr. Israel, can you hear me? May they send
Yes,
me
I can
gifts now.
hear
Nobody,
you. Sorry,
nobody is
I think
sending me
my
gifts. Yeah, you think you're what?
my network. I don't understand. I have subscription, but the thing refuses to connect. So I have to do some
Okay.
other connection.
Okay. So we have a comment, a question here. So many questions are pouring in, but they don't want to send us encouragement. Ah, God. Rita is asking us a question. I missed her question. After contraceptive, my menstrual cycle changed. My period changes every 3 months. Doctor, what advice do you have for her? Hello.
Your okay for you, your period is now every 3 months. I think you need to see a gynecologist. If normally you've been seeing your menses every month, and after you use contraceptive pills, your period started, your hormone is your
Ah, Omomikuna see comment. Oh, Jesus Christ. Jesus Christ. Make una see comment. Dr. Israel, your network is see, they have followed you today. Your people have followed you. Okay. See comment. Oh, thank you for the stars. EC, thank you for sending me stars on Facebook. Congratulations, Favor. Favor, people are telling you congrats on Facebook. Congrats. Congrats. Make una send us stars. Make una know things say I will come the form online. You know me, right? After I stopped my family planning in 2020, my menstruation stopped, but later resumed in 2021 with thick, stopping flow for just a day. Please, I need advice. Angela, okay. I think that 2021, this 2022, and just one day. So one day is not normal, madam. One day is not normal. Trust me, it's not normal. I think the best advice for you right now is that see a gynecologist so that let them find out what is going on. Is it hormonal or there is something else? But seeing your period for just one day, I don't think it is normal. Yes, for just one day is not normal. And there are a lot of factors to consider too. It might be from the contraceptive or something not related to the contraceptive. God, make una see question. Oh, I have seen your question, Rita. What could be the possible issues for a sudden? Hey, God, Snowizi, are you responding to these things? If it continues, please go back. Yes, good. I also went through stress after the miscarriage. Today, God has done it again. God bless you. Congratulations. Oh, you are pregnant, Amaka. Congrats. What could be the possible issues for a sudden longer period? When you say sudden longer period, is it just the first time in a month? How can you calculate your safe period during monthly cycle? It's on YouTube. Go to my YouTube channel. Yes. Onyewumi Snowizi has responded to you. Yes. God, make una see comment on this thing. Oh. What causes blood pressure and how to control it? That one is on, I think you should go to my Facebook, maybe it's there. Be safe, you mean you cannot get, oh God of heaven. Make una see comment, Jesus Christ. Dr. Israel, I think you'll be responding to this comment right now. Let's go back to Facebook. Dr. Israel, see this comment here. Doctor, if somebody menses stop and after 7 days it comes back, what could be the cause? Voila.
Okay. Remember we were saying that when you see your menses and maybe you now see it again. So if it's not almost the same time, the same number of times, it may not just be your menses. Actually, most persons that normally say they see their menses for a few days and it's Jesus. Hello, are you with me?
Yeah, I can hear you, but I can't see you.
Me, I don't even know what is going on. Me, I cannot even see myself.
Okay, you can just use the voice. Close your camera. Let's see if it will help your data.
Okay, as I was saying, as far you can hear me. As I was saying, so hello.
Hey, my God, voila. Somebody's asking us that she's pregnant and she has fibroid and she's having pain. Your pain could be from your fibroid. Somebody's asking us if a woman that is 46 years old, seeing her period, if she can get pregnant. Yes, it's possible, but just that the chances of you getting pregnant spontaneously is reduced. This question is on TikTok. Yes, if a woman is 46 years, seeing her period, and she wants to get pregnant, seeing her period, she can get pregnant. Oh, just that the chances of spontaneous pregnancy is reduced. As a woman increases in her age, the chances that she will get pregnant spontaneously. Hey, Anitex, good evening. How are you now? The chances that she will get pregnant spontaneously reduces. So from 35 years and above, as a woman increases in age, we are not saying she can't get pregnant, but the chances that she will get pregnant spontaneously, like a woman in her early 20s, is very, very reduced. Yes, she can get pregnant. However, she might need medical intervention. Okay, okay. Back. Let's do this. Okay, Israel. Okay, welcome back.
Yeah. Okay. So as I was saying, so that lady will likely benefit from seeing a gynecologist. If actually if that's the first time and maybe that other blood she saw there was no pain, maybe it just came out. We also want to find out if it's after you had sex, because it might just be injury from that, or you just need to wait to see your next menses, how it goes. If your next menses comes out normal, sorry, and there's no other, you didn't see such thing, I think you can let go. But if you are still very scared, you need to see a gynecologist who can actually tell you what next to do. Yeah.
Thank you, Dr. Israel. We have 60 people on TikTok. Make una send us stars now. Hey God. People on Facebook, welcome. People on TikTok, we're talking about period twice in a month. We are almost out of time. We have a few more minutes and then we are done. Angela is asking a question. After stopping family planning in 2020, my menstrual flows. Okay, we have answered this. We have answered this. But I think we have answered this. I've responded to this. So Susan is asking a question. My question is to know if menstrual period can be reversed in a premenopausal situation.
If it can be what?
If menstruation can be reversed in a premenopausal situation, if her menses can be reversed. I really don't know what she means by reversed, or reversed.
Reverse to where?
That's
Okay,
what we don't understand here.
premenopausal situation, you still have menses. You are still
Wait,
seeing your
wait. Is
menses,
it
so your menses
premenopausal?
have not.
Let's get it clear. Is it premenopausal or postmenopausal? It's important. Thank God. Snow Wisi just asked us. Let her clarify. Is it pre or post? Pre means you are not yet in menopause, so you are close to menopause.
Yes,
Post means
you are still
you
seeing
have
your menses.
entered. You have entered. If it's menopausal, postmenopausal, they can give you hormonal replacement therapy. If that's the case, hormonal replacement therapy to help you. If
Yes,
that is what you're talking about.
you start seeing your menses again.
Yeah. How can I unblock a follow? Hey, cute spice. How are you? My battery is down. Dr. Israel. Okay, we have a question
Yeah.
here. We're almost out of time. Hey God, make I see you. Okay, God. Let's see. How many more questions do we have? Okay. Few more questions and then we are done. It should pre before your doctor can help you manage it. Okay, let's see. Do we have any more questions here? How can I unblock if a fallopian tube that is blocked?
For premenopausal, you are still seeing your menses, so I don't know why you want to reverse, or I don't know what you are trying to what the question is all about, because you are still seeing your menses.
Dr. Q Spice, I salute you. Thank you. Been a while. My battery for this is not good. Somebody saying, please, if a person is near menopause, can that make her menstruation to flow heavily and more than 5 days?
Yeah, that's premenopausal. Yes, it's possible. Yes, in that stage, in your premenopausal period, close to your menopause, your hormonal system does a lot of funny things. A lot of funny things. For some persons, I told you that the person may experience long cycle. Yes, while some persons may their menstruation may become scanty, some may be having a heavy flow and all that. But if you think it's very disturbing, you need to also check the uterus. If it might just be the presence of fibroid that cannot that is actually causing the bleeding. So that's another perspective. But yes, in a premenopausal people that are close to their menopause, they can actually have something like this as well.
Okay, thank you, Dr. Israel. We have a comment on TikTok. Let's respond so that we prepare to round up tonight. Can a blocked fallopian tube be unblocked? Now, Dr. Snowizi has answered you, and said that depending on what is blocking the tube. But if we are talking about fallopian tube blockage, there could be multiple blockage. If now fibrosis, that one a very, very special case. So if you have a blocked fallopian tube, the advice would be for you to see a gynecologist. If they can help you unblock the tube, they will tell you. If the chances of success is very slim, they would also let you know. You understand? I know there are people out there that will tell you that they can flush and open your blocked fallopian tubes. Some people like that. So please, I beg, you should please speak with a gynecologist if your tubes are blocked. Yeah. Okay. Dr. Israel, do you have anything to add to this? We're almost out of time.
No, I think you guys have answered. You should say
Okay.
gynecologist. That's all I can say.
Okay. We are rounding up. We are rounding up very soon. Now, I'm ending on this note. Dr. Israel will do the remaining answering and Snowizi. I see so many comments, and I'm saying this again on TikTok and Facebook. I'm saying it every time. I see people requesting to speak with me. I beg, I beg, I beg. I dey beg every time. People know this. People know. I know they do private chats. You understand? I don't do private chats. I have my reasons for that. So please, if you are listening to me on whatever platform, YouTube, Facebook, Instagram, TikTok, you want to private chat me, I've closed my inbox because of some experiences in the past. You understand? So I don't stop them. I know they do them. But my colleagues, they do them more. So you can, if Snowizi is open to that, Snowizi, you can chat up Snowizi, fine. Or you can chat up Dr. Israel. If they are okay with it, you enter their inbox, chat up with them, no problem. But me, I know they do them. I don't stop them. You go to my page, you will see a video on my page. I've stopped it unless you click on the link on my profile, you book my private time, you pay for my private time. I beg. I know they hide my mouth, talk this thing, because every day I come online and people are asking, I want to call you, I want to chat with you. No vex. I don't stop them. I know they do them here. Thank you. Dr. Israel, please respond to the remaining comments.
Okay. There's no comment here.
Okay, no comments on Facebook. Let's see if we have a few comments and then we stop. Doctor, please, what could be the reason for a reoccurring miscarriage? Can you hear me?
Okay, yeah, I can hear you. Recurring miscarriage, there are many reasons, and they can be in different stages. Yeah, they can be in different stages. Now, for those within the first, okay, you know, the pregnancy, we have 3 trimesters. We have the first trimester, the second trimester, and the third trimester in pregnancy. And most of the miscarriage can occur within the first and the second trimester. So miscarriage within the first trimester may just be the body, mostly the first few weeks. It's just the body trying to, because the body noticed that that pregnancy is not really a normal pregnancy, or it will not give a normal baby, and the body feel that this thing is not cool. The body can just actually get rid of the pregnancy. So that's one way, and it means that the body is the one that is doing what it wants to do. That most of the pregnancy that occur within the first trimester are almost like that. Now, for the ones that will occur within the second trimester and all that, it can just be one, either there's a weak cervix, that is, the cervix is weak, it cannot hold the pregnancy, so the pregnancy fall off. So there are ways we can actually tie the cervix so that the pregnancy can remain in the womb term. Also, some pregnancy that is coexisting with uterine fibroid the person can also have spontaneous and miscarriage. Can also have spontaneous miscarriage where the baby is supposed to go and attach to. That's actually where the fibroid is. That can actually cause miscarriage. Also, if your blood group, you have a rhesus negative and you're pregnant for the first time and you are now sensitized, and your next pregnancy is not rhesus negative like you, and the person didn't take drug that you were supposed to take, yes, that can also lead to spontaneous miscarriage often. So okay, so the infection, malaria can also lead to spontaneous miscarriage as well. So these are some things, but for someone that's always having the miscarriage, we want to find out one, when did it occur? The first one, how many weeks was the pregnancy before you had the miscarriage? The second one, how many weeks? So that will give us an idea what is actually causing it. And most of the time, it can just be the weakness of the cervix, which is actually easy to take care of. And when we take care of it, it's actually, you can carry your pregnancy to term. Then some hormonal issues can also lead to that. When there's low progesterone, it can actually lead to that as well.
So Dr. Israel has answered you and told you the causes of miscarriage.
But in all, you need to see a gynecologist. A gynecologist will tell you all other causes, and will also give you the best treatment that you will need. Please don't just visit any doctor you see. I say a gynecologist. A gynecologist, the doctors that are specialized in treating women. Let me use that. Okay, thank you.
Thank you very much. So we have made so many videos online. You can go through our pages. Dr. Israel is also making content, very important content. So you can follow the doctors you see here. Go through our pages. You will see some of the videos there that have already answered some of the questions you are asking us. We have to go now. This program is every Sunday by 8 p.m. on Facebook. We have 80 people on TikTok. Thank you guys for tonight. This program is every Sunday, 8 p.m. West African time on Facebook. By the grace of God, Facebook, YouTube, TikTok, maybe Instagram. So we encourage every one of you to please join us on time by 8 p.m. We'll always be here, and we'll do our best to respond to every one of you. And any final word, Dr. Israel? Any final word?
Okay, for anything I want to say is that for people that see your menses twice in a month, first of all, you need to know your cycle, how your cycle is. So if your cycle is within 22, 21, 23, 24 days, it is normal. However, if you are seeing if you don't have short cycle, if you have short cycle and you see your menses twice in a month, it's also normal. But if you don't have short cycle and overnight you start seeing blood like that, please visit your doctor, a gynecologist to be precise. Please visit your doctor. And also, I just want to bring to our notice that 1st of December is World AIDS Day. So if you have not checked yourself, don't know your status, it is good to know your status, and that's that. So have a good night rest. And I will say good night to everyone. And thank you for following us. Thank you for joining us every Sunday using your data. Every Sunday by 8 p.m. using your data to listen to us. We say a very big thank you. If it's not you guys, I don't think we've been able to do what we do. Thank you.
Yeah, thank you so much to everybody joining us every Sunday. To those of us that share these videos, that send stars, we want to say thank you very much. We have made so many videos. I'm sorry that we cannot respond to all your comments. We have to go. We are very time conscious. But what you can do is this, please go through our pages on Facebook, on YouTube, on Instagram, on TikTok. You will see some videos there. Please watch them. They would help you. We want to say a very big thank you. And for those that are requesting to ask my WhatsApp number, no vex. Go to my page. You will see a link there on my page for me. You will see a link there. Click on the link, and somebody will respond to you. Like I always say, good life now waiting. Good life.
That
Good life.
sense.
Good life now sense. Thank you. God bless every one of you. We'll see you again next Sunday on this same page. No African time. 8 p.m. on the dot. We are starting. Snoweezy, thank you so much. When I get money, I will buy another good phone so that I can be coming live very well on TikTok. Thank you, everybody. Thank you. Sincerely, I say a very thank you. We are grateful. We are really, really grateful. God bless you and have a wonderful night. Bye bye.